Formation of bone during fetal development occurs by two processes: the endochondral ossification and intramembranous ossification. So the intramembranous ossification, that happens in the fibrous connective tissue, and it begins when osteoprogenitor cells turn into osteoblasts, and this happens in the deeper layer of the dermis. And it begins at the center of ossification, which is in the membrane. The formation of bone comes out of these centers as trabeculae, and they're produced, which will develop into a solid mass of woven bone as it makes more and more trabeculae. And as the bone grows, the blood vessels invade the spaces between the trabeculae, bringing the cells that are developing into bone marrow. And then once the woven bone is laid down, the osteoclasts begin to remodel to make lamellar bone, which is like the more mature bone, I guess. And flat bones of the skull aren't completely formed by birth, and they're left with gaps between them. And this is so that when the child is coming out of the birth canal, their skull can kind of deform and be shaped without hurting them. And then we have the endochondral ossification. And this replaces the hyaline cartilage with bone tissue, and it's the primary or the main method of forming all of the other bones in the body. It starts in the outermost edge of the cartilage within the perichondrium, and the newly converted osteoblasts, which were from the osteoprogenitor cells that we talked about up there, they secrete osteoids. And once they're completely encased, the diaphysis forms the periosteal bone collar. And then as the periosteal bone collar forms, chondrocytes within the shaft start to enlarge, and then they change cartilage matrix to calcified cartilage. And once the chondrocytes are encased in the calcified cartilage, they die, and they kind of cause a porous Swiss cheese type of